I'm Dr. Sue Chang from the College of American Pathologists and City of Hope. As a pathologist, I'm your doctor who specializes in diagnosing diseases through microscopes and laboratory medicine. When you get a Pap test, HPV test, or some other types of gynecologic tests, I'm the specialist who evaluates that specimen and provides results to you and your primary care physician. I'm here today to answer some of your most common questions about Pap smear tests, HPV tests, and results that you may see in your pathology report. One common question is, what happens with a Pap smear? The Pap smear is often performed in combination with an HPV test. Your primary care doctor or gynecologist will collect cells from the cervix using a specialized kit. The collection swab can actually look a bit like the COVID test swab. The kit is intended to safely and effectively collect cells from a specific portion of your cervix. The specimen is preserved in a fluid, and that container is sent to the pathology laboratory, where I and a team of laboratory technicians perform two different tests on the one container, the Pap smear and the HPV test. The Pap smear looks at cells under the microscope. That's what I do. The HPV test looks for HPV infection. We use a machine to detect those changes. So with one collection, our patients get two things tested, the better to detect precancer or cancer. In the United States, testing recommendations differ based on age and health history. For most patients with cervixes, some combination of a Pap smear test or an HPV test will be used as their screening test. These recommendations can be different based on age, and they are occasionally updated by different medical societies. The most important thing is to get screened. Most guidelines recommend Pap smear test in patients aged 21 to 29, and some combination of a Pap smear or an HPV test in patients aged 30 to 65. The recommendations apply to individuals who have a cervix, regardless of their sexual history or HPV vaccination status. Thanks for watching. I hope I've answered some of your questions. You can find more answers to questions about your pathology report at yourpathologist.org.